more than the required dose, it's just like you took a tablet or two tablets of what codeine. So this is the way youths do abuse drugs. Other ways is that
Hello, good day everybody. In today's video, we want to discuss about drug abuse. So most of us that are making use of chemotherapy treatment, most times we are engaged in one way or the other in a drug abuse without even knowing. So in today's video, we are going to discuss different ways we can abuse drug without even knowing, and the implication of drug abuse. Please, before we continue this video, I would like you to press like and subscribe button. It will help in the YouTube algorithm. So this medical practitioner that I'm staying with will educate us the implication and even the meaning of drug abuse. Thank you. Please try and watch this video to the very end, because you will learn a lot from it. Thank you.
thank you once again. I will advise everyone watching this video to first of all click the like button, subscribe to this channel, because this very topic I think everybody needs it. Old, young, everyone needs this very topic. Now let's get started. Drug abuse. Drug abuse. We are so common with this word. We have made this word something so cheap. But I have discovered that the area at which we are taking drug abuse, I think there are some little places where we are neglecting it, and yet we are still making mistakes in drug abuse. What is drug abuse? I would say that drug abuse is taking drugs out of doctor's prescription or without doctor's recommendation. Self-medication is a way of abusing drug. You are prescribing for yourself, you're not a practitioner. Is a way of abusing drugs. That is why I said taking drugs out of doctor's prescriptions or taking above what doctor prescribed. You might ask me how. For instance, you will see someone who is sick or is passing through some illness, then because a doctor prescribed a particular drug for him, and maybe that drug worked for him yesterday, he will keep on taking that drug every day. Whether the sickness is still there or not, he will keep on taking the drug every day without any doctor's recommendation. To some certain extent, he can also advise someone by the side who might be having a similar challenge to start taking that drug. And medically, they might be having two different things altogether. So these are ways of abusing drugs. I'm just trying to pass out some explanations. You can still, now let's bring it very close to ourselves. Do you know that we can still abuse paracetamol? That's the commonest drug that we can get within our side. You can still abuse it if you take it out of doctor's prescription, or if you take it uh, 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 because you think your body needs it at that very time. I have discovered that we have majorly two reasons why people abuse drugs. One is they abuse drugs because they don't know the side effects. Two, they abuse drugs because they don't know that they're abusing drugs. Now, some people know that actually I am abusing these drugs, but it is helping me to do some certain things. Then he'll keep on abusing it. At this point, he knows the side effects, but he thinks that the profit he's making from it is more than the risk rate in it. Whereas others are abusing drugs, not knowing that they are abusing drugs. This has to do with especially this our mothers at home or parents who are not much educated. They just take anything that they see. Now, how do we abuse the common drugs within our vicinities or within our localities? Let me give you an example. You might be having body pains. Because you know that you're having body pains, you keep on taking a particular brand of body pain drugs or analgesics, that's the medical term, every day in, day out, you're taking analgesics, whether you're having it or not. In fact, every day you walk, you must take it. At a point, this drug will cause something in your system. Most of the people that are having kidney problem these days, Most of them were caused by the kind of drug they were taking for so long. Not that they have plan of abusing this drug. They are taking it to help their health issue, not knowing that they are damaging their health state at that very point. Now, other drugs that we do abuse are hard drugs, those that will help us maybe to walk, to do carry out our daily activities. I will start to mention some drugs name, some medical terms that we use in it. For instance, guys are very conversant with tramadol, codeines, because they know the that it will help them to carry out their daily activities. Even pentazocine injections and many of them. There are many of them. And one thing is this: there are some drugs that are produced for a very particular purpose, but Nigerians or youths are more interested in knowing what the effects will be when they abuse it. I have seen a situation whereby someone buys a cough syrup, a bottle of it. Then instead of taking 10 ml of it, he took half of the bottle. Inside that bottle, we have 100 mils inside it. Then he took 15 mils instead of 10 mil. At that time, because he took the drug more than the required dose, it is abused already. What is his reason? His reason is just that he wants to be strong at that very time, due to the fact that most of these are that contains codeine inside. So when you take more than the required dose, it's just like you took a tablet or two tablets of what codeine. So this is the way youths do abuse drugs. Other ways is that, just like I said earlier, I told you that we can also abuse taking paracetamol. There are some families that you will never look for paracetamol and you never see there. They always have paracetamol on their table. Once you're having headache, you're taking paracetamol. Running stomach, you're taking paracetamol. Every day you must take paracetamol. Some that have strong system, it do help them, sha, but this is also a way of abusing drugs. Now, another thing is self-medication. Self-medication. For instance, there are some in our field, there are some areas which you are not expected to operate in. Every medical field has where you will stop and you let others to continue, people higher than you to continue. For instance, when you are managing BP or sugar level, now you can't give someone that have sugar level drug because he told you that he's having sugar level. You must first of all run a test to know the state of that sugar level at that very time, and you know how to give. And as you are giving that person the drug, you are monitoring the rise and the falling of it. There is a drug you will give someone that has high sugar level, and the thing will drop drastically that you cannot control it again. Then, in issue of BP, if you are monitoring a high BP or low BP, you must have an apparatus that you will use to check the person's state before prescribing drugs. You don't just prescribe because you think you know drugs with BP. There are thousands of them out there, but they react in the body differently. The one that Mr. A might be taking might be different from one that you are taking. Same also the to one that Mr. B is taking. So whenever you discover any health issue, the best option is this: visit a medical practitioner, explain little what is happening to you, and take the drug just as he prescribed for you. Now, lastly, there are some drugs that are given at a stipulated time. You are to take this drug for a stipulated time. For instance, sleeping pills. Doctors will give you at least take 5 days or 3 days, because he knows that once he keep on giving you these drugs every day, at a time or at a point you can never sleep without taking those drugs. That is when addiction comes in. You can never sleep without taking those drugs. So a doctor cannot give you more than 5 tablets of diazepam to take, because he knows that it will help you to sleep. But what if your body system gets used to that very drugs, then you can't do without it again. So this is why we must not abuse or take any drug beyond doctor's prescription or with our own imagination. And anything you are taking, make sure that it is being prescribed by a.
Thank you for watching. Please, I would like you to comment on this video. Please press like and subscribe button. it will help in the YouTube algorithm. Thank you.